It is a temporary fix that some parents say has just gone on for too long. Today, they're voicing their opposition about keeping masks mandatory in Oregon schools.
So Lisa Balick heard their comments at today's hearing, and she joins us live. What do they have to say, Lisa?
Well, there are still a lot of people who are against the masks in schools, but there are an awful lot of people who say, look, we think it's a good idea. Among them, state health leaders who say, look, now is not the time to take off the mask as we're in the middle of the surge.
Forcing young children to mask day in and day out is an abusive form of conditioning. You're teaching them submission and nothing else. Only a truly evil person would vote to mask children indefinitely.
Dozens of angry parents urge the Oregon Health Authority to back away from the mask requirement for kids in school.
Our kids have been forced into a state of fear and have been led to believe that they are to be feared unless their faces are covered. They've been denied the basic right to breathe fresh air and to visualize facial expressions.
But health leaders maintain masking helps prevent COVID transmission, especially the highly contagious Omicron variant, and Oregon is in the middle of the surge right now.
This is not the time to be lax and to avoid some of the things that we know prevent the spread.
State health leaders say safety measures like required masking has helped Oregon lower case counts, hospitalizations, and deaths. And the masking requirement for everyone in schools is a way to try and help keep schools open and prevent transmission in classrooms. The state health authority wants to make masking in schools and public places a permanent rule instead of temporary, set to expire in about 2 weeks. That's when, though, hospitals are expecting to see the peak of cases. Senator Ron Wyden is meeting with emergency room staff around the state, working to see how he can help their efforts to recruit and retain hospital workers.
I'm looking at ways to reduce, for example, tuition. I'm looking at ways to expand loan forgiveness, and I'm looking at ways in which facilities can partner with each other.
Now, state health leaders say they want to make it permanent. Basically, it's just a logistics issue that they intend to get rid of it when certain things happen, such as hospitalizations go way down and the number of cases go way down. We'll keep you posted as to what they decide perhaps later this week. Live in downtown Portland, Lisa Balick, KOIN 6 News.